Periodontal disease, also known as gum disease, is a bacterial infection affecting the gums and the bones surrounding teeth and can eventually lead to tooth loss. More than 45% of the UK adult population are affected by gum disease in some form, so it's actually very common. Gum disease can present in different forms, and our treatment approach at Pure Periodontics will vary accordingly. Gum disease is often overlooked, and there may be very few symptoms in the early stages. Although some patients may not have any visible signs, there are some typical signs and symptoms of gum disease. These include swollen and bleeding gums, bad breath, loose teeth, multiple gum abscesses, receding gums, and tooth sensitivity. These symptoms can have a huge impact on a patient's quality of life and the level of confidence, from their ability to smile to the type of foods they can eat and enjoy. The key message here is that in the early stages, certainly, gum disease is preventable and treatable with correct expert advice and management. This is something we at Pure Periodontics take very seriously, educating our patients on the best way to prevent the more serious effects of later stages of gum disease. There is also mounting scientific evidence of a link between gum disease and other general health diseases such as diabetes, heart disease, and Alzheimer's. It's also crucial that pregnant women are aware of the risks of gum disease, as during pregnancy increased hormone levels can cause an aggravation of existing gum infections. The entire mouth is a significant source of bacteria, with plaque bacteria forming in all of our mouths every single day. If this is not effectively removed from the gum margin, inflammation can occur due to toxins being released from the bacterial plaque. This initial inflammation of the gum is known as gingivitis, and it is reversible if treated correctly. At this stage, many patients will experience swollen and bleeding gums, particularly when they're brushing their teeth. Bad breath is also a common sign of gum disease. If gingivitis is not treated, the condition can progress to periodontitis, a stage that's no longer reversible. At this stage, there will be loss of bone support surrounding the teeth, as well as loss of protective fibers and ligaments that would normally seal the gum to the tooth. Essentially, this seal is our body's first line of defense against a bacterial infection in the gums, so without this barrier, gum disease can be initiated. Smoking is the most significant risk factor for gum disease, and it's associated with the development of periodontitis and increased risk of tooth loss. Having the ability to help patients transform and regain their lost confidence in a matter of weeks is one of the most rewarding aspects of what I do. As specialists, we offer treatments to stabilize the gum disease in order to arrest bone loss, inflammation, bleeding gums, and eliminate bad breath, but most importantly, potentially prevent tooth loss.